there. Please stop.
I will be talking about avoiding hypoglycemia. I'll be talking from the Indian point of view. Let's define the definitions for hypoglycemia level 1. We have glucose value of less than or equal to 70. I know everybody knows this. This is just a brief overview. Signifying immediate action is required to prevent any further decline in blood sugar levels. Level 2 is a significant level where the blood glucose level is less than 54 milligrams per deciliter, which is presenting, of course, a risk of neuroglycopenia, which can lead to severe cognitive impairment if not promptly addressed. And level 3, there's no specific threshold. However, that does mean that they need outside assistance. Symptom recognition, we have early symptoms and neuroglycopenic symptoms. Early symptoms are shakiness, sweating, and anxiety are common indicators, and neuroglycopenic symptoms are confusion, dizziness, irritability, which signals serious issues. Silent threats, nocturnal hypoglycemia, you all know this. It must be ruled out if the patient reports night sweats, recurring vivid dreams or nightmares, early morning headaches that disappear after breakfast, and hypoglycemia unawareness. Loss of sympathoadrenal warning signs and neuroglycopenic manifestations are the initial presentations. There are risk factors among elderly, autonomic neuropathy with beta blockers, and those who are under tight control. Now, this is just the tip of the iceberg. There's a lot more going underneath. Let's compare some data. The prevalence in India of hypoglycemia stands at approximately 57%, which is significantly higher than the global average of 45%, which indicates that we are in dire need of awareness and intervention. The primary trigger for hypoglycemia in India is missed meals, 89.3%, versus global, which is exercise and dosage miscalculations. Why the high risk factors? In India, we have the phenotype thin fat body composition, which increases the risk of hypoglycemia, a delayed insulin initiations that leads to poor glycemic control, and sulfonylureas that we just heard that does increase reliance on SUs over modern treatments. Dietary triggers in Indian households is, of course, refined carbs. Our meals are more carbohydrate based, which causes glucose spikes, which in turn leads to risk of hypoglycemia. And then we have herbal supplements. Some herbal supplements may interact with medications that does cause unpredictable levels of hypoglycemia, and which increases the risk. Now, we can have effective prevention with nutrient sequencing. We can tell them to start off first with fibers, low calories, high fiber diet, and then we can move on to protein. Include protein in their diet, and then lastly, carbs. Now, how do we manage risks during fasting and festivals? During fasting, we usually tend to tell them 30 to 50% dose reduction is required. And of course, same goes for Navratri, for anything. Ramadan is coming up. However, if they are fasting, we should warn them that please break your fast if your glucose falls below 70. Now, if in doubt, treat it as a risk of hypoglycemia. If we don't know it, at least we can assume and at least start treatment for hypoglycemia just with clinical suspicion. Of course, we can then confirm with blood. If we have the glucometer, we can confirm it. Now, how do we treat it? 15-15 rule, as we know. Immediate correction, give refined sugars or liquid carbohydrates. Wait for 15 minutes or 15 grams of glucose. Wait for 15 minutes, and then you follow it up with complex carbohydrates. In unconscious patients, if they have IV access, great, inject 25% glucose IV. If not, then you can administer glucagon, 0.5 to 1 milligram, IM or sub-Q. And if they do regain consciousness, then you go back to protocol 1 with oral carbohydrates. Precipitating factors, I did mention few, but we'll still take a look at them. Delayed or missed meals, that's #1 cause in India. Unexpected calorie intake reduction, sudden vigorous activity, errors in dosage and timing, which is more at a global scale, renal and hepatic dysfunction, defective counterregulation, interaction with other medications or herbal supplements in our country, change in insulin species, not so much now, and change of injection sites, intramuscular injection, and subtle hypothyroidism and or adrenal insufficiency that we talked about yesterday. Now, summary and action plan, what we can do as physicians, as diabetologists, we can advise our patients to carry a hypo kit, which has essential items like glucose tablets, sugars, honey, anything quickly, and also have a hypo card that says, I have diabetes, I may be unconscious due to low glucose. So in case they're found, if they have their card, someone can give them glucose. Monitor levels, tell them to regularly check their blood sugar levels before driving or before sleeping to prevent dangerous hypoglycemic events. CGM is always great for these things. And we have to educate the family because in India, there is, we have more, instead of nuclear families, we have extended families. So we should educate the entire family, inform family members about recognizing hypoglycemia symptoms and importance of timely intervention to enhance their safety and support. Thank you.